Hi there. Welcome to the From Lab to Launch podcast by Qualio, where we share inspiring stories from the people on the front lines of life sciences. Tune in and leave inspired to bring your life-saving products to the world.
Welcome to another episode of From Lab to Launch by Qualio, where we look at the exciting movers and shakers shaping the future of the life sciences industry. I'm Meg, your host, and today we welcome Tina Liedtky, President of the Transplant Diagnostics Division at Thermo Fisher Scientific. As the organ transplant list continues to grow, experts in the transplant diagnostics industry are looking for ways to address the supply and demand challenges within the field. New tactics like retransplantation and xenotransplantation and new testing methods such as HLA testing and transplant diagnostics are being explored to boost transplant success rates and ensure more patients get the life-saving transplants they need. As Thermo Fisher's head of transplant diagnostics team, Tina is at the cutting edge of meeting this challenge. She is also passionate about addressing the health equity issues, such as ingrained biases regarding gender and race, to help bridge the transplantation gap. Tina, thanks so much for joining us today.
Thanks, Megan. Thanks for having me.
Great. It's great that you're here. So you've been leading the Thermo Fisher's transplant diagnostics team for just over a year now. Before that, you spent 3 years as the president of Clinical Diagnostics Division. How did that move come to pass, and what new challenges have you faced moving into the from clinical to transplant?
Yeah, great question. So as you mentioned, I was leading a different division of Thermo Fisher called Clinical Diagnostics, which was more sort of broad diagnostics in the sense of having a variety of products and services for the clinical community. For transplant diagnostics, it's just that very focused on transplant. And I would say I thought the transition was quite smooth. The principles of diagnostics are the same, whether you're in transplant or in another field in diagnostics. For transplant, I just have fallen in love with it. It's a really tight community of industry players like ourselves, clinicians, and nonprofit organizations, all trying to work together for the patient and do the best for them.
That's great. In your role, you've driven 2x market growth since taking over the transplant diagnostics team. Can you walk us through that journey and how you've impacted the division?
Yeah, great question as well. So I think it's a special time in the transplant space where the number of transplants is actually growing. And you alluded earlier to the fact that there is a supply and demand imbalance that still remains, but there are a lot of players in the system that are trying to solve that problem, either, as you said, through xenotransplantation, or in the case of nonprofits like the National Kidney Foundation trying to encourage living donation. So the number of transplants is actually increasing, and there's an opportunity for us as manufacturers of diagnostic tests to be part of that and to help grow the industry. And the way that we do that is providing innovations that help clinicians make better decisions. So to your point, there's the HLA typing and antibody detection part of the business and the space, and that's where Thermo Fisher, through our One Lambda brand, has been a leader for over 40 years. So we provide these tests that help match patients with potential donors and ensure that the organ doesn't reject once they have the transplant. So that's a really critical part in the entire equation. But then there's also advanced diagnostics that will help patients live longer, healthier lives post-transplant. And so what we've been trying to do is introduce these new technologies and help our customers understand what they are, show the clinical proof, the data for them, so that they can adopt these technologies and hopefully help those patients to get their organ successfully and then live long lives afterwards.
That sounds amazing. Are there some real world examples of how your work impacts patients you could share with us?
Yeah, absolutely. So we do everything from, as I mentioned, HLA typing and antibody detection. That's actually the core of our business. And that's not something new. It's been around for, I would say, 40-ish or 50 years. Previously in the past, when transplants first started, there wasn't a whole lot of information for clinicians to say, okay, this is going to be a match for a potential patient who needs a transplant. Sometimes you would look at siblings or close relatives because you would assume that they're matching genetically. But what we've learned is that your immune system has a large part in really that compatibility. And so with HLA typing, what we do is look at that immune system, the human leukocyte antigen system or HLA system, and we say, okay, I've looked or typed this person's HLA system, and now I'm going to look at the donor organ and see if it's a match. And we found that that is really critical to creating a successful match. And that's something that's been the cornerstone of transplantation for decades now. What we're trying to do now is to go beyond that into what we call the post-transplant side of the house. So once they match and they get a successful transplant, then, okay, now here's a problem where, okay, now I've got my organ, but now I need to live taking immunosuppression drugs that are very harsh on my body. You're more susceptible to things like cancer and other complications, and you have to be monitored frequently with invasive methods like biopsies. And so how can we make the post-transplant part of the journey a lot better for patients? And so what we're trying to do is introduce new technologies, new tests that give clinicians information that may allow them to reduce the number of drugs that a patient needs to take, or may reduce biopsies themselves. So the patient doesn't need to go through this invasive experience.
Yeah, I love that, solving not just the initial problem of needing the transplant, but being able to support it going forward, because that's so critical to longevity for the patients. That's great. What trends will you define in the transplant sector, let's say, like in the next decade? What do you see kind of being cutting edge and new in transplantation?
Yeah, absolutely. There's a few things. I think you alluded to one earlier, and that's called xenotransplantation. That's when you're looking at animals as a potential resource for organs. So as you had alluded to earlier, there is a massive problem right now with a supply and demand challenge, where there's so many more people who need an organ than organs available. There's a figure, I think it's over 100,000 patients are on the wait list in the US to get a transplant or get an organ. And really, there's so many fewer organs available. And in fact, 17 people die every single day waiting to get a transplant, an organ. So, you know, those figures to me are staggering, and it just shows that, okay, we need to do something to really resolve that imbalance. And so, you know, I think xenotransplantation is promising. The medical community is looking at ways to ensure that there's compatibility between animal organs and human bodies. And there have been a few xenotransplantations that have occurred over the last few years, some with particularly swine or pig kidneys and hearts. Unfortunately, it's still early days. A lot of the patients who receive those transplants don't survive very long. There's actually a woman, I believe, from Alabama who's now living 2 months post-transplant with a kidney from a pig, which is promising. So I think as we learn more, that will only get better, and hopefully that's going to be part of the way that we resolve this supply and demand challenge in the future. I think another really interesting innovation, which Thermo Fisher is actually involved in, is having a better look at the genetic makeup of a patient and a donor. So we do look at that HLA system that I mentioned, your immunologic makeup. And now we're using things like gene expression technologies to look at your gene profile and to see if there's a match with the donor and your risk of rejection of the organ after transplant. So, you know, hopefully that will allow for more personalized approaches to medicine, where after the transplant, perhaps we can modulate the amount of immunosuppression drugs that someone takes, and it would be less harsh on their system. There are some patients that take up to 20 different drugs a day, and you can imagine that's hard to be compliant with, and also creates a lot of side effects as well.
Wow, that's a staggering opportunity there to fill those gaps with a few different methodologies. We talked a little bit about it in your intro, but can you tell us a little bit more about the transplantation gap and how we can start to close that?
Yes, absolutely. So we talked about the supply and demand gap, and there are different ways that that's being solved. One is through these innovations. So can we find a source of organs that are viable? There's also some other innovations happening by industry players, and one of them is around organ preservation. So once you get an organ, you have very little time to transplant it. You need to get it to a center, and the patient needs to be there. The admitting team and the medical team need to be there and ready to go, and you often only have a few hours. So there are actually companies now that are creating organ preservation devices that will help preserve that organ in transport and ensure that the quality of that organ is also, preserved, so that you have a better chance of utilizing that organ successfully. And that will play a large role in the success of the transplant and also the health of the patient after they receive that transplant. Unfortunately, there's still a lot of organs that are discarded for whatever reason. The quality is not good, or it doesn't match with the patient. So that's something that is sort of a growing trend, as well as organ preservation. And then there are some policy changes as well happening. And you may have seen there was an article actually in the New York Times that came out just last week that talked about inequities in the organ allocation system. So every country has a different way of allocating these precious organs that are in short supply. And in the US, you enter a wait list, and that wait list is then governed by a body, and that there are certain parameters for being on the wait list and who gets to the top of the wait list. It's usually, the sicker patients or those who will have a better chance of, having a healthy life post-transplant. They get to the top of the list. But either way, there's a long wait list time. Oftentimes it's years. And I think on average in the US, you have to wait for 3 years to get a kidney on the wait list. Now, what that article had exposed is that there have been some inequities in the sense of jumping that line. And there have been organs, a few hundred organs actually, in the past few years that have gone to people that weren't at the front of the wait list, but rather are further down in the wait list and have gone to centers that have been preferred. And so I think that's also a huge problem, unfortunately. And I think a lot of that has stemmed from the fact that there is a lot of pressure in the system. So the Centers for Medicare and Medicaid Services, CMS, had a couple of years ago instituted some new guidelines for the organ procurement organizations. So these organizations that help get organs, and there's a lot of pressure for these OPOs to use more organs and ensure that those organs are utilized once they procure them. And so, potentially there's some of this adverse behavior happening because of these guidelines. CMS is actually also instituting another set of guidelines called the Increasing Organ Transplantation Act model, access model, or IOTA, and that is going into place. It's going to start this year. And what that does is it's going to measure at first the top half of the centers in the US on several metrics. And some of them have to do with the number of transplants they do, the number of organs that have been offered that they utilize, and then post-transplant, sort of the rate of graft survival, the survival of the organ. So in theory, all of these things will help increase the number of transplants that happen and the quality of transplants. But I can say that in talking to industry professionals, to clinicians, and those sort of in the ecosystem, everyone's sort of kind of, feeling, okay, what does this mean for me and how do I react to it? So I think there's still a lot to be seen in terms of how these new CMS rulings impact the industry, either positively or maybe adversely in some ways.
I feel so enlightened on transplantation on so many fronts. Tina, you've been a wealth of knowledge so far. A passion for me is quality and compliance. How does that thread into your work, and how do you maximize the quality and integrity of what your team is doing?
Yeah, that is a really great question. Quality is top priority for us, and it's fundamental to the success of in vitro diagnostics, as you know. In transplantation, ensuring that the diagnostic tests maintain the highest quality standards is fundamental. It's paramount to the success of the transplant. So, you can imagine poor quality products can lead to less accurate tests and therefore less successful donor recipient matches. And, if your test isn't accurate, then the clinician could make a decision that is not the best for the patient. So we're always striving to ensure that our products are the highest quality, follow the highest quality standards. And I think we have an obligation as manufacturers to continually improve our processes, improve our training so that that is the case.
Terrific. What lessons from your journey would you share with aspiring life science leaders?
Oh, wow. That's, I would say, do something that you're passionate about. And I found that I'm really passionate about transplantation. It's a really field that's really close to the patient, which I'm really passionate about helping patients. And you can really make an impact by the things that you do, whether you're a manufacturer, whether you're, working in government, whether you're a clinician, whether you are a quality professional, and you just have to make sure that you remember your purpose and why you're doing what you're doing, and as long as it aligns with that purpose, I think you can spend your lifetime doing that. And for me, my passion is helping patients, and I definitely feel that in the transplant community.
I feel it just from talking to you. I feel like we could spend hours talking about all of these things around transplantation and the policies. I would love to learn more. But our last question here is a fun one. We'd love to ask all of our guests if we ran into you at the bookstore or at your local library, in what section would we find you, Tina?
Oh, wow. Great question. So I go to a lot of sections of the library. I'm currently reading a book actually by a woman who spent her life as an apprentice of Rosa Parks. So as you know, last month was National Black History Month, and we were very fortunate as Thermo Fisher to be awarded the Rosa Parks Spirit Award for our work in health equity. And that was a great honor. But as part of that, I was really lucky. I got to receive a book from her apprentice, who's a remarkable woman, and she wrote a really nice message in the book and signed it. And it was all about, trying to ensure there's equity and ensure that there's justice for everyone. And I really love that message. And it's a really fascinating book and gives you a glimpse to who Rosa Parks really was, and this remarkable woman that was by her side. It's called By Her Side, for 45 years.
That's terrific. I'm going to have to put that on my nightstand as well to read. Thank you so much for joining us today, Tina. It was truly a pleasure. I feel like I've learned so much today from chatting with you. Where can those who want to follow along with your journey in transplantation go to find you and connect and learn more?
Yeah, great question. I'm on LinkedIn. I post a lot about the things that we're doing with the transplant community. And for anyone who wants to be involved in what we're doing, don't hesitate to reach out.
Terrific. Thanks so much, Tina. It was really a pleasure having you here today.
Thanks, Megs. Thanks for having me.
Thank you for listening to this week's episode of From Lab to Launch, brought to you by Qualio. If you like what you've heard, please subscribe and give the show a positive review. It really helps us out. For more information about Qualio, our guest today, or to be a guest on a future episode, please refer to the show notes. Until next time.